Hey guys, this is Christopher South, and this is going to be a video that talks a little bit about one of the treatments for patients who have severe heart failure. And you may come across a couple of these patients in the emergency department. And so I wanted to give a little quick presentation for all of my folks that are in my AMP2 class on ventricular assist devices, otherwise known as VADs or LVADs. So what is a VAD? So a VAD basically is a mechanical device that is placed deep into a person's chest where it helps the heart pump oxygen-rich blood through the body. And this is kind of what the VAD looks like. And we're going to talk about all the components and specifically what it does. So how does it work? Well, basically the device takes blood from a lower chamber of the heart. It helps pump it to the body and vital organs just as a healthy heart would. And so basically it bypasses. The basic parts of the VAD include a small tube that carries blood out of your heart into a pump, another tube that carries blood from the pump to your blood vessels, which delivers the blood to your body, and a power source, which are the batteries that are found on the outside of the patient's body, usually in a vest. The power source is either batteries or an AC power, which the patient will use when they're not out walking and different things like that. The power source is connected to a control unit that monitors the VAD's functions. The batteries are carried in a case, usually located in a holster in a vest wrapped around the patient's shoulders. The control unit gives warnings or alarms if the power is low or if it senses that the device isn't working right. It is a computer. It's like a little computer box that sits on the patient's abdomen, and it's what actually controls the VAD that's placed inside of the patient's chest. So, who needs a ventricular assist device? Well, heart failure patients specifically. A VAD may be placed in patients who are awaiting transplant. So, if a patient's on a heart transplant list or awaiting that, a patient may get a VAD as a temporary solution until that heart can be acquired and be placed into the patient's chest. It can be a temporary treatment for a patient with severe heart failure, or it may be a permanent long-term solution for a patient who has heart failure who may not be a candidate for heart replacement and no other alternatives are available. So an ICD is also known as an implanted cardiac defibrillator. All right. So a lot of their patients who do have a ventricular assist device will also have an ICD. You can typically palpate it under the skin on the left upper chest. It feels like a hard, round disc. It's under the patient's chest. An external defibrillator by a cardiac monitor AED is appropriate. So if we do have a patient that does have a VAD, and they do go into cardiac arrest and we have to provide emergency care of them, it is perfectly appropriate to perform external defibrillation by either a cardiac monitor or AED. However, there are some drawbacks. Please do not place defibrillation pads over the device, which is going to be the ICD. And remember, that is on the left upper chest of that patient. Consider anterior posterior placement of AED pads or monitor defibrillator pads is by putting them right over the sternum and in the center of the back. So this is some of the components of the VAD. The first thing we have is known as the inflow cannula. So the inflow cannula, as you can see where it goes into the body, the pump, the outflow graft, the drive line, the controllers, and the batteries. And you can see how this all works together to control the actual VAD device that is inside just below the heart. And you can see that part of the graft goes up into the aorta. We have the line that goes down, which is the actual pump itself, the HeartMate 2 LVAD or heart pump, and then it grabs blood from the the left ventricle and injects it up into the aorta. So basically, we're kind of bypassing that left ventricle. So here is what's really tricky for a lot of providers when we're dealing with a ventricular assist device. Well, the whole vital signs thing gets a little bit different. The absence of a pulse or blood pressure is a normal finding. Now, for a person who doesn't have a VAD, that would be pretty disturbing, honestly. But for a VAD patient, the VAD is it's different than the heart. The heart is a pump. And so with that pump, we're going to find that pulsation as the atria and the ventricles are contracting. We don't have that. Instead, the VAD is a centrifugal pump, so it has a little disc that's on the inside of the pump that spins. And so as it spins, it's keeping a continuous flow of blood to go through the heart. And so instead of that pumping action, what we're going to get is pretty similar to how like a pool pump works, as you can hear that whirling sound. And so on these patients, what's really cool is if you will use your stethoscope and auscultate right over where the VAD is installed, you can hear a whirling sound. It sounds like whoo. We can hear that rushing of it. So a couple of things. You're not going to have a palpable pulse, and obtaining a blood pressure is going to be done by obtaining the mean arterial pressure um, through using a Doppler device. SpO2 may not be accurate in these patients. So do some old school stuff. Check for signs of perfusion, including skin color, mental status, and capillary refill. This is going to be great when looking at a ventricular assist device. So remember, guys, for a VAD, no pulse, no problem. So some of the treatment things that we see with patients that have VAD devices and site infections and stroke are the two biggest complications with patients who do have ventricular assist device. Treat it as you would with any other patient with similar symptoms. Always do your primary assessment, which includes assessing the airway, breathing, and of course, circulation. And one of the main things that you need to do with any patient who presents to you who does have a ventricular assist device, they are going to know their family. They're going to have this information available to them 24/7 is the number for their ventricular assist device coordinator. The coordinator is going to be an amazing resource for you. As you call the coordinator up, they're going to tell you all about the device, about the patient, their history, what's going on, their medications, everything that's happening. And they're also going to give you some treatment options and guidelines. So as soon as you have a patient that has a ventricular assist device, whether they come to the emergency department or maybe you're an EMS and you go to their house, please contact that VAD coordinator. So in the event that this person does deteriorate and resuscitation is necessary, CPR if absolutely necessary. All right. This is typically if the device is not functioning properly. Now, if the device is still circulating blood, all right, keep that going. Pacing is okay. Perfectly okay to pace if they're bradycardic. All right. Defibrillation is also okay. Be mindful again of where the pads are. ACLS meds, completely okay. So you can give your entire regimen of all of your advanced cardiac life support meds. Totally all right. Again, anytime that we're doing anything with a ventricular assist device patient, we should contact that VAD coordinator. Troubleshoot the VAD device because failure could be cause of the arrest. And again, this is why it's so important to contact that VAD coordinator who can walk you through some of the troubleshooting and everything that you may need to do. Things to do on an LVAD call. Assess the patient's airway and intervene per your local protocol. Auscultate heart sounds to determine if the device is functioning, what type of device it is. If continuous flow device, you should hear a whirling sound. Again, it's a running that you're going to hear. Assess the device for any alarm. So the little box that they have, if you're looking on that, it will flash and it will tell you one of the more common alarms that we see on a lot of these patients is called a low flow alarm. This could be because they're hypovolemic. Intervene appropriately based on the type of alarm. Start a large bore IV if you can gain that access to a large bore IV. So a large bore IV typically is an 18 gauge or above. Assess vital signs. So use mean arterial pressure, the MAP, BP with a Doppler. Well, if the first sound you hear is the mean arterial pressure, all right, so just like if you were checking blood pressure on a regular patient, that first sound that you would hear, with the cortical sound would be that systolic pressure. And then you listen to that when it disappears, of course, is the diastolic pressure. We don't get that with a VAD patient. So that first sound you hear is the mean arterial pressure known as a MAP. All right. Transport to the closest VAD center. So again, contact that VAD coordinator, get that advice where they want them to go or whatever. Bring all of the patients and equipment with you to the hospital, and make sure that if a patient does arrive to the emergency department, that they have all their equipment with them, especially backup batteries and a place to plug in their battery charger. Very, very important. So troubleshooting, and this is one of the most common alarms. And again, I really want to push the fact that you need to call that VAD coordinator, because they're going to know this device. We don't see these very often. When the pump is stopped, if the pump is stopped, make sure to bring all of the patient's equipment with them. Fix any loose connections to restart the pump. If the pump doesn't restart and the patient is connected to batteries, replace the current batteries with a new fully charged pair. Now, when we're talking about changing the batteries out, you don't need to take both of the batteries out and change them at the same time, because that pump will stop. We change them one at a time to make sure that we still have power going to that pump. If the pump does not restart, change controllers. That patient will have a spare for everything. And so that controller is the unit that's on there. We can change that out as well. And again, changing the battery is a big one. Change them one at a time. Never take both batteries out together. Line them up as directed on the batteries. And again, bring the extra batteries and the charger with you. Low flow alarm. This is one of the most common ones that we see. All right, so this is the control unit that we will see. This may indicate a low flow hazard. Check the patient. Flow may be too low, which is typically the patient may be hypovolemic. If the patient is hypovolemic, give volume. And again, coordinate how much volume to give with the VAD coordinator and your physician. If the patient is in right heart failure, treat per protocol. If the patient is stopped, if the pump is stopped, check connections, batteries, and a controller. So we're talking about right heart failure versus left heart failure. So one of the ways to understand that is left heart failure, all right, starts with the letter L. And so left heart failure is going to be back up into the pulmonary circulation. So patients with left heart failure typically get those wet lung sounds. They may have a pink frothy sputum that comes up. Right heart failure is where we see backing up into the rest of the circulation. So that blood flow that comes from the superior and the inferior vena cava is going to back up. And so this is typically where we see that edema, especially in the feet, legs. We can also see sacral edema in patients who were bedbound. And so it's a good way to remember that. L is going to be left, L equals lung. All right, guys, I hope you enjoyed that. And if you have any questions or anything, by all means, again, this is for educational purposes only and is not intended to as any kind of protocol or treatment or anything like that. Again, this is for educational purposes only. I hope that you did enjoy that video. Again, keep on subscribing and understanding more about cool things where anatomy and physiology meets the streets. And again, this is great information for a device you may not see very often. What is cool is that patient's not going to have a pulse or a blood pressure. Have a great day, and thanks for watching the videos, man. I enjoy making them. Have a great day.